All right, welcome to the Beasley Equine Podcast. I'm your host and equine veterinarian, Dr. Travis Beasley. Today we're going to dive into gastric ulcers in horses. We're going to talk about what they are, how we treat them, how we diagnose them, and most importantly, how to prevent them. So stay tuned to learn all about ulcers.
Veterinary surgeon or start to come quick. Draw the syringe and give it a flick. Bring your little black bag with the medicines in. Bring the trank and the crank and the penicillin.
So according to the American Association of Equine Practitioners, 90% of thoroughbred racehorses and 60% of Western performance horses are affected by gastric ulcers. And I think those numbers came before our technology was good enough to really look into the stomach. I think they were barely getting a camera in there and counting that. So I think if they redid that calculation, they'd find the numbers are actually even higher than that. So what is EGUS? Equine Gastric Ulcer Syndrome. It's kind of like colic. That term describes ulcers in the stomach, but there's some unique things about the horse's stomach that we have taken into consideration, and that guides our diagnosis and treatment as well. Horses' stomachs are very unique because they actually have two different linings in them. The top half of their stomach is what we call the squamous epithelium, which is the same lining as their esophagus and the same lining as our esophagus. Then it's separated by this real distinct band called the margo plicatus, and under that is the glandular epithelium. And the glandular part of the stomach is like our stomach. It's what secretes acid, and it can take the acid. So we can see ulcers in the top half, the squamous ulcers, and we see ulcers in the bottom half, or glandular ulcers. And they're still ulcers in the stomach, but they're completely different diseases, and their causes and treatments are different. So they live in the same room, but they're not really related to each other. So we break these things down, and we have to really determine on where the ulcers are and which part of the stomach and how bad they are and how they look, and that's what guides our treatment of these things. So the top half again is what we call the squamous epithelium. And if you've ever had heartburn, horses with ulcers up there is probably what it feels like. Because in human, GERDs, or gastric esophageal reflux disorder, is where the acid or reflux goes up and burns our esophagus. And if you've ever experienced that, you know how uncomfortable it is. And these horses with ulcers up there probably feel like they have heartburn all the time. And that pain's really hard to get away from. And I know the few times I've experienced it, I'm pretty grouchy and irritable. And I think if somebody put a cinch on me or asked me to do something, I would be pretty grouchy too. So we'll talk about some of the symptoms of ulcers later, but that's a big one we deal with. So the squamous we break down even more. You can have some primary or secondary causes for it. It literally comes from the acid getting up there and burning a hole in that epithelium or that lining of the stomach. And in the bottom half, it's more of losing the protective mechanism of the stomach. And understanding these things are really important to know, because that's how we prevent some of these things too. So you've probably heard of people grading ulcers, grade 0, 1, 2, 3, 4. That is only in the top half, that squamous epithelium. The bottom half we don't really grade. We just kind of describe those lesions. So if we think a horse has ulcers, what do? We scope them. That's the only way to diagnose these things accurately and get an effective and accurate treatment plan. But how do we know if a horse may have ulcers? There's tons of different symptoms. And if you kind of think about it, like when you have heartburn, a lot of those symptoms we see a lot of grumpy geldings, moody mares, reluctant to work, picky eaters. We get some people that'll call and say, hey, my horse, he'll eat his hay, but he doesn't really want to touch his sweet feed. And I always use the analogy, that's like putting a bowl of broccoli in front of a kid and a bowl of cookies, and the kid reaches for the broccoli. There's something going on, and we'll talk about what sweet feed does in relationship to these ulcers, and you'll understand that quite a bit better. Some of them are behavioral changes, pinning their ears when they eat. They don't want to load in trailers. They don't want to work. I think if we really listen to these horses, they tell us something, and it doesn't mean we need to train on them harder. We need to really pay attention to what they're trying to tell us and understand what it could be. And with the prevalence of ulcers that high in horses, with sudden temperament changes or changes in their willingness to do stuff, it makes sense that we scope a lot of horses first to rule out ulcers. If they scope clean, then we go down other rabbit holes to try to figure out why they're showing us these symptoms. So one of the other things we always talk about in the symptoms is a decrease in performance, which anybody that's out there competing, whether it's barrel racing, team roping, whatever you may be doing, a fraction of a second can mean the difference in getting a check or not. And show fees, entry fees, they're not cheap. So it's important to really, really think about, what are the reasons this horse isn't doing as good this weekend? What has this horse been through? And I think it's like anything with the horses. They have their own defense mechanisms for things, whether it's talking about joints, muscles, and the stomach. It's when the aggressive factors are worse than the protective mechanism. And a lot of the ulcers we deal with is management, and we screw up these horses by trying to ask them to do too much or trying to feed them too much. So the other thing we need to know is that stomach acid is not only the hydrochloric acid that the stomach's producing. There's also volatile fatty acids, there's bile coming in. In humans, we have a gallbladder. I'm sure everybody knows somebody that's had a gallbladder taken out. Horses, evolutionary, are designed to be all-day grazers, which, if you look at the natural horse herds, it doesn't mean they stand in one spot and eat a nice bale of alfalfa from just say, hey. It's not very good forage, so they eat a little bit, have to walk a little bit, eat a little more. So horses don't even have a gallbladder. They have a constant secretion of bile that comes in from the liver into that first part of the small intestine right behind the stomach, and it gets into the stomach as well. So the squamous ulcers, like the GERDs in people or heartburn, is basically from the acid in the stomach getting up and making contact with that part of the stomach. And you can kind of think of it like holding a lighter to your hand. The longer that acid sits there, the worse it's going to hurt and the deeper hole it's going to burn. The defense mechanisms in the bottom part of the stomach are a little bit different. And we'll talk about those when we dive more into the glandular part. And then when horses eat, they make saliva. And saliva has bicarb in it, and they swallow that saliva, and that buffers the acid down there. And there's also blood supply to the stomach. That's part of the defense mechanism, and then that's important for the ulcers in the bottom half, because whenever you ask a horse to do something other than stand there and eat, especially run or do something performance-wise, the horse diverts its blood supply away from the rest and digest part of the system, and it's sending the blood and oxygen to the heart and the lungs and the muscle, and some of that blood supply to the gastrointestinal tract decreases, and that decreases some of the defense mechanisms. So there's some guys in the 90s in Florida, Campbell, Thompson, and Merritt. They put cannulas in these horses where they could collect juice right out of the stomach. And what they found was anytime a horse got out of a walk, the pH dropped to 1 or 2 in the top part of the stomach, which it should be up closer to 7. And so with the pH, the higher the pH, the less acidic it is. The lower the pH, the more acidic it is. And that has a lot to do with how we treat these things and how we can prevent these. So the way a horse is made, you've got lungs, and then the diaphragm sits behind the lungs, and then your stomach's sitting there, and there's colon right behind it. And what happens as soon as you take a horse out of a walk, and it doesn't matter if it's a trot or a gallop, canter, that stomach gets squeezed between that colon and the diaphragm, and it can push that acid up into the glandular part. And that's when we get what we call an acid splash. So that's important to know when we talk about some feeding recommendations to prevent this. Or if a horse eats a big meal and eats it all at once, and then the stomach empties, that stomach decompresses and the acid rises up to the top to that glandular part. So anytime there's intensive exercise, we're taking blood away from the GI tract, away from the stomach, taking away some of the protective mechanisms, and we're diverting it to the heart and muscles and lungs and stuff like that. The other thing that's very important to know about these stomach ulcers is the high carb, high sugar diets that we've developed for these performance horses to get the energy and the calories they need to do the jobs that we ask them. So they also, that group with the cannulated horses also collected the gastric juice, we'll call it, not just stomach acid, because it's a whole juice of different stuff in the stomach, the volatile fatty acids, the hydrochloric acid, the bile acid. And what they found was the sight and smell of grain increases acid production within about 15 minutes. So when you're feeding a horse that sweet feed, it's kind of like your dog in the morning that starts drooling when you open up that can of feed. That stomach's going to start cranking acid because it knows feed's coming. And when we feed these diets, they don't chew as much because most of it's made to be really palatable, so they can eat quite a bit without chewing as much. And when they don't chew as much, there's not as much saliva. And like we mentioned earlier, saliva's got the bicarbonate in it that helps buffer that acid. So the third thing these concentrate high-carb feeds do is when they get to the stomach, they're fermented into volatile fatty acids, lactic acids, and alcohol. And that the increase in that acid, of course, makes the stomach more acidic, but it also does something else. If the pH gets just below that 4.5, those volatile fatty acids actually cause those stomach cells to swell. And when they swell, they get acidified because it's when the cells drop that low, when they're exposed to acid that low, they actually get some of that acid into the cell. And that shuts off some sodium pumps that's necessary. We're kind of getting deep in this, but sodium, as you know, draws in water. So if we shut down these sodium pumps, they get an accumulation of sodium in the cell, and then water rushes in, and that's what causes those cells to swell. And what's interesting about this is that study found that the cells don't swell with just hydrochloric acid, just the stomach acid. It has to be those volatile fatty acids because the fat is what stimulates this whole process we just talked about. So what causes the glandular ulcers in the bottom half? Again, we know more about the squamous ulcers than we do the glandular. We know that it's more of a management thing that's causing the squamous ones to form. That acid gets up there and burns a hole in it. The ones in the bottom half of the stomach or the glandular part, we know way less about. We know stress has a lot to do with it, and exercise has a lot to do with it. Horses that are ridden more than 5 days a week are 10 times more likely to get glandular ulcers. And there's a growing body of evidence that increased stress causes these ulcers as well. But, when we think about stress, what is stress for horses? It's hard to put your finger on certain things, and we'll see tons of horses come in and be like, oh, he's a laid-back horse. He's not under any stress. But some of these horses will be so stoic, we don't know what's stress for them. Even though they stand good for the farrier, that may be super stressful for them. Hauling them to shows on the weekend, that may be super stressful for them. Isolation may be super stressful for them, leaving them in a stall, not letting them go out with their buddies. Anything we're taking away from the natural behavior of the horse can be stressful for them. So we'll talk about that some more when we talk about preventing these things too. So when we talk about the prevention, there's three main factors that contribute to these squamous ulcers: the increase in carbs, not enough roughage, and too much exercise. So when we think about preventing them, we have to address all three of those. Not addressing one of those factors isn't going to do it. We have to do all three. And there's quite a bit of evidence that stress doesn't play a role in the squamous ulcers, or those ulcers in the top part of the stomach. So how do we tackle those three things? The first one's the carbohydrates. Reducing carbs can make a big difference, but what they found in the research and the studies that anything above 1 gram per kilogram is a 2.5 times increase in these ulcers. But that's actually quite a bit, and at least in our population of horses, nobody's feeding more than that anyways. So, but that is one thing we can do, is decrease the carb in these. Some of these can do better with higher fat feeds, lower starch, and sugar. So with that being said, there's, sweet feed's not the devil. We still have to feed some of these in these performance horses, but there's ways we can counteract those detrimental effects of the high sugar diets with roughage. And like we said earlier, roughage, they chew that more, they get more saliva, they get more bicarb, and that buffers the acid. And quantity and timing is critical in feeding roughage to your horse. So we always talk about alfalfa hay being better for these horses that have ulcers, and that's mainly due to the calcium in the alfalfa. Calcium acts as kind of a natural antacid and buffers some of that acid in there. But any roughage is better than no roughage. It doesn't have to be a really good alfalfa. Grass hay is better than nothing because they chew it more, and then that hay gets in there and forms basically a mat in the stomach. And when we talked about that acid splash earlier with the stomach getting squeezed between the colon and diaphragm, if there's hay in there to kind of prevent that splashing from happening, that's important in these horses too. So that's one thing we can do to prevent ulcers, is making sure a horse has a full stomach of roughage before you get on there and ask them to do too much. And then a lot of people say, my horse is out on a pasture 24/7, and that's not that protective either, because some pastures really lush and green and high in sugar, and some of that stuff tends to leave the stomach pretty quick as compared to hay like alfalfa. So even though they may have ate and grazed all morning, that stuff leaves the stomach pretty quick, and it attributes to that acid splash. So when we think about feeding roughage to a horse, this is a common question everybody asks us, is how much hay does my horse need? And some of it depends on the hay, but it's kind of a general rule of thumb is 1 to 2% of your horse's body weight. So your average 1,000-pound horse, you're thinking 10 to 20 pounds. And the other important thing to know with that is, just because your horse needs 20 pounds, if you go throw 20 pounds of hay out there, they may eat that relatively quick. I mean, we've all seen those foundered ponies that can eat their daily ration in no time. So decreasing the amount of time between meals can really help with this too, because that stomach's not going to empty, and it's not going to sit there empty. And one thing that all the studies have found is if your horse goes for more than 6 hours between eating, especially roughage, they're 6 times more likely to get, or 4 to 5 times more likely to get ulcers if they go more than 6 hours without eating. And that's pretty common at some of these horse shows, where you have a run or two and then they stand tied to a trailer, which you should put a feed bag there so they can eat. And even some of the trail horses, I mean, it's not uncommon for people around here to go out and trail ride all day, and their horses not get much besides what they grab off the trail here and there. So remember that 6-hour rule. And then a slow feeder is awesome for these horses too. Kind of decreases the amount of hay they can get in one bite. It makes them chew more, gets more of that saliva down there. and it spreads that meal out where that stomach stays full longer. And an interesting thing they've done with these studies is they've learned that most horses in a barn situation, if they throw all the hay they want in a stall, around that 10 o'clock at night, most horses quit eating and they kind of go to sleep. But they did some unique studies where they put sensors on these horses and they hung up 2 hay bags, one on each corner of the stall. And those horses tended to eat more overnight, and that kind of mimics the natural grazing of the horse. So that's one thing you can do is overnight, instead of just throwing a bunch of hay in one corner, hang up 2 slow feed bags in each corner, and they'll spend a larger amount of time grazing overnight when their stomach may have been empty if we didn't do that. So we want to work with their evolutionary behavior to increase this roughage. And the other thing we preach to our clients with their horses is forage first. If you can remember that, that'll cover you with a lot of this stuff we're talking about. So when we say forage first, I know it's real easy to go through and feed the whole barn sweet feed and let them eat and then throw in the hay. But if you can feed them their roughage first, or their forage, that will get more of that saliva in the stomach, more of that bicarb, and then they don't get that increase in the acid production they get from smelling and seeing that sweet feed. So always feed your forage first, whether you're just feeding for the day, and you can think of forage first as far as the performance aspect goes too. Before you're going to ride your horse, feed them forage first. We recommend anywhere, depending on the size of the horse, 2 to 4 pounds of alfalfa before you ask them to do very much exercise-wise. Again, decreases the acidity in the stomach, gets the saliva in there, and it makes a big mat of food in there that's going to decrease that acid from splashing whenever that horse gets into a trot or a gallop. And then the other thing is the training. We talk a lot about that acid splash that happens in the trot or canter. So that's kind of a big thing to think about whenever you're cooling your horse down. You know, a lot of people want to do these long extended trots, but that's just as hard on the horse's stomach as cantering. So what we'll recommend to people is doing more of an extended walk to cool that horse down. And also these horses that, you know, and I understand from the training aspect that you got to get these horses where you need them, but if you can get them to do more of what the human people call the HIIT training, the high intensity interval training, that's more beneficial for a lot of these horses because they get in there, they do their job, and they get done, and then they can start walking again instead of a lot of trotting to warm up, that's splashing that acid. So timing that way, decreasing the amount of time your horse is at anything over a trot or a trot can really help prevent these acids and ulcers. And the other thing with timing is when you exercise your horse. Like I said just a little bit ago, most horses in the morning have been standing around without any feed in their stomach, and that stomach's collapsed, and that acid can rise up to the part of the stomach that's sensitive to it. So if you go out and grab your horse first thing in the morning, you're going to really increase the chance of that horse gets to have ulcers. So make sure, again, that 2 to 4 pounds of alfalfa or roughage, if you don't have alfalfa, get that in the stomach before you ask your horse to do anything. And again, it's the lighter to the skin analogy. The longer that acid is up there against that part of the stomach, the more it's going to burn and the deeper it's going to burn. So those are some good prevention tips for the squamous part of the stomach, which is, again, the top part of the stomach that's really sensitive to the acid. When we talk about glandular ulcers, or the ulcers in the bottom half of the stomach, that's kind of more of the lining of the stomach we have to address the risk factors that we talked about earlier. Giving your horse days off per week is super important, these guys. And I understand that these horses need wet saddle blankets to train them. But if you can give them the scheduled days off, 2 to 3 days off a week, you're going to decrease that horse's risk for stomach ulcers in the bottom part by tenfold. And then again, the environmental factors. Like, these horses are herd animals, and a lot of these show horses stand around in a stall all day. They don't get to express any of the herd behaviors like the grooming, letting them just be a horse for a while. Turnout is great for horses. And a lot of people with show horses are nervous. They'll get little scratches or cuts or play with their buddies and that. But the risk of ulcers is way more than what we see with horses turned out a little bit that get these little minor things, if it happens at all. And then some of the natural grooming behavior between these animals. I think it's Dr. Sykes did a study that they found horses that are blanketed are at an increased risk of ulcers. And they believe it's that natural grooming behavior they can't do. And again, that doesn't seem stressful. We think we're helping them putting these blankets on, but on the other side of the sword, we're probably not doing what's best for their stomach. And this sounds funny to say, but a lot of times we compromise the welfare of these horses by taking too much care of them and not letting them be a horse. And then the other part that comes into play with ulcers in the bottom half of the stomach, that the glandular part, is NSAID use. And NSAIDs are your nonsteroidal anti-inflammatory drugs, which include bute and banamine, ketoprofen, Equiox. Although Equiox, the firocoxib, is the drug, it's more selective for the receptors that leave the stomach and those things alone. So anytime we can get away with firocoxib or Equiox, we will pick that over bute or banamine. We have to use NSAIDs in horses. We have to use them in us, but we have to recognize the risk that come along with them too. So that's kind of why these ulcers develop and some of the signs. So if your horse has any of those symptoms or is at risk like we talked about, how do we diagnose these things? And if you look up diagnosis, you'll see, and I even see veterinarians posted on YouTube pushing on trigger points on them and seeing if they react. There's really no scientific evidence and no studies to my knowledge that gives any merit to those. And I wouldn't be surprised if these horses hurt and you're poking them, you're going to get a reaction, but it doesn't tell us if they actually have ulcers or where they're at in the stomach or how bad they are, which is going to guide the treatment that we'll talk about here in a little bit. They used to block some of these horses. They basically tubed them like you would a colic and give them a big dose of lidocaine, see if the symptoms go away. And I've done that in a colic situation because if the stomach's full of feed, we can't just scope them right away. We also see people like, well, we just want to treat them for a while and see how it works. And sometimes that's not wrong, but we treat the glandular ulcers a little bit different than the squamous. So if they have bad glandular ulcers, a week of GastroGuard may not make much difference. And if it doesn't, you can't say, oh, well, he doesn't have ulcers. We tried this. But they may just have them in the bottom part that aren't going to respond to just GastroGuard alone. And there's no blood work we can do that says it. Some horses with severe enough ulcers will bleed and they'll get mildly anemic from that. But we have to really know your horse's normal red blood count to know if he really is anemic, and that's not that accurate. There's also some tests where we look for blood in the feces, and we'll do that sometimes, but that's a little more sensitive for hindgut ulcers or ulcers in the colon. And 90% of the horses with blood in the feces will have ulcers, but about 20% that have blood in there are negative for ulcers too. So, and again, even if we think this horse has ulcers, we don't know what exactly to treat it with and for how long or whether to recheck and stuff like that. So the gist of all these different diagnostics is to tell you that gastroscopy or sticking a scope in your horse's stomach and looking is the definitive way to say, yes, they have ulcers. This is the part of the stomach they're in. This is how bad they are, and this is how we got to treat them. So when we talk about treatment, the goal, of course, with anything is to make your horse feel better. And if some of these horses that come in with real severe ulcers, I swear they look at you in the eye and it's just like, please help me. Please do something to make me feel better, because they stand around miserable. And then, to make these horses feel better, like these athletes need to perform at the top level. So a fraction of a second can make a big difference on a weekend, whether you bring it home a check or not. So if a horse has ulcers, whether it's in the glandular part or the squamous part, we're going to treat them with omeprazole. And it's the same drug as people, except we have to reach for Gastrogard in these cases because of the acidity in the stomach. If you just go by the I think it's a purple pill people take, if you give that to the horse, they're not going to absorb it because the stomach acid basically tears up the drug before it can even get absorbed by the horse. And that's true with a lot of the generic or the non-FDA approved ulcer treatment that contains omeprazole in it and the compounded stuff. In a nutshell, the compounded or generic Gastrogard, it just doesn't work. So I would advise anybody out there to stay away from those, because even some of the studies they've done, they've looked at the compounded omeprazole and they've tested the actual omeprazole on the drug, and it may not even have what they claim it has in there. And then if it does, by 2 or 3 weeks later of getting a scoop out of there, the drug is decreased, and then you're just wasting your time and money when your horse could be feeling better and working better. So again, it's so important to know where these ulcers are at in the stomach. With the squamous epithelium in that top half of the stomach, we can get by with omeprazole or Gastrogard alone. And the Gastrogard is not going to heal the ulcer. What it's going to do is decrease the acidity in that stomach and let the stomach kind of heal itself. And based on the severity of the ulcers, how many they are, how big they are, that's what guides us in how long we're gonna treat these horses. Because I don't know if any of you guys ever bought Gastrogard, but it's not cheap. And if you have an ulcer that's going to clear up in 7 days, you don't want to treat this horse for 4 weeks. Or vice versa, if you have ulcers that are going to take 4 weeks of treatment and you only treat for 2, then you've just wasted all those 2 weeks and all that money. So with the squamous ulcers, we can get by with Gastrogard alone, and we've got enough experience in the vet world that we can kind of know, based on the severity and location, how long it's going to take to treat these things. And the real severe ones will recheck. And we've had some that, the Gastrogard's an amazing product. And one reason it's so expensive is all the time and money they invested to develop an omeprazole that the horse can absorb and use and fix these ulcers. So the squamous, we can get by with Gastrogard alone. When we get down to the glandular ulcers, or the ulcers in the bottom half of the stomach, Gastrogard's still a mainstay in our treatment to decrease that acid so it can quit burning a hole in those. But we also have to add in what we call a mucoprotectant, or something that will bind to the ulcerated stomach and protect it while it heals itself. And we use sucralfate a lot in our practice. We'll stack it with the Gastrogard, and then sometimes we'll reach for misoprostol too, which is another thing that helps protect those ulcerated places, and we have to stack those. And the glandular ulcers, or the ulcers in the bottom part of the stomach, usually take a minimum of 4 weeks, and sometimes 2, sometimes 3 months. And they're so hard to tell people, like, yeah, these are going to heal up in a month. We may recheck them in a month and they're not much better, or they're mildly better. We may recheck them in a month and they're completely gone. And a lot of these owners, I know they're following our protocol. It's just the nature of those ulcers in that part of the stomach. So they're kind of a headache. I hate diagnosing them because the treatment's so intense and expensive, and it's hard to tell people, like, it's going to be fixed in a month. Most of the time, we can get them knocked out in a month or 2 or 3, and people, even though they're not healed all the way, the symptoms go away and they get their horse back to that sweet horse that they were before, and they're not trying to kill you at feeding time or trying to kill their pasture mates. So you have to develop a treatment plan based on where those ulcers are and how bad they are. And scoping horses is the only way to get that done. And then part of the treatment, besides just the medicine, is what we talked about earlier with different management things as far as feeding, when to feed forage, how to feed forage, and the different types of grain, like the high carb, low fat, or high fat, low carb. And there's a lot of medicines that claim to work. There's a lot of supplements that claim to work. There's only 2 or 3 supplements that have any science behind them. So I'd caution people to just buy whatever somebody on Facebook is claiming will fix ulcers or prevent ulcers. And if you do a quick Google search and look up ulcer prevention, you're gonna drown in all of the different preventions. And when I talk to people about preventions of things, I always tell them you can't prevent something that's already there. So if your horse is displaying signs of ulcers, you're not going to fix them by giving them a prevention. You can't prevent something that's already there. So we have to fix these ulcers. We have to diagnose them. We have to get the appropriate treatment. We got to get them fixed. And then we can talk about prevention. And the prevention's a lot of management, and a lot of these supplements work. We use a lot of Protect GI in our practice. It really works on those glandular ulcers. And sometimes we'll stack that with our treatment as well. But I tell people too, you can't diagnose what you can't see, and you can't treat what you don't diagnose. So unless you're sticking a scope in your horse's stomach and getting a complete look of everywhere, all the way from the top part down to where the food is emptied into that small intestine, and we'll actually go into that first part of the small intestine and look for ulcers in there. If you can't diagnose it, you can't treat it. So getting an accurate diagnosis and getting an accurate treatment plan is so important for these ulcers. And then I'll leave you with a quote. There's been several people that have claimed it. I don't know who actually is responsible for this quote, but absent a diagnosis, medicine is poison, surgery is trauma, and alternative therapy is witchcraft. So us as veterinarians, we're advocates for the horse, the whole horse. So we like to know these horses from head to tail, and just thinking your horse has ulcers and trying some product you buy online, it's not fair for the horse. So even, if your veterinarian doesn't have a scope, find out the closest place that does it and can do a good job. We get sent some scope pictures from horses that aren't prepared properly and fasted, and they don't get a complete exam of the stomach. And it's so important to see all of the stomach on these scopes to make sure you don't miss anything. So, again, prevention-wise, forage first. Always get that mat of alfalfa or any other hay in there before you exercise them, and then let them be a horse. Decrease the intensity of the duration of the training, increase the intensity, and do everything you can. And we're going to put together a PDF that'll be in the show notes that breaks down the prevention tips, and we'll also have a link to a YouTube video that just mainly covers the prevention tips that you guys can do. But again, you can't prevent something that's already there. So if your horse has any of the symptoms we talked about, it's always worth the money to get your horse scoped and get in there and see what's going on. And even if the scope's clean, then that tells you we got something else to look for. So with that, we'll leave you. Take care of yourself and your horses. Until next time, thanks for tuning in.